Hey everyone, welcome back to my channel, all about my life after... You guys can be quiet while I record. Hey everyone, welcome back to my channel, all about my life after gastric bypass surgery. My name is Stephanie, and this is my 6-month update. I'm going to start off by saying that if you hear weird noises and little tiny peeps, I do still have ducks in this room. And as of this last week, I actually have 2 more ducks in this room. So I have 4 ducklings in this room in 2 separate boxes, and it is noisy and just there's a lot going on. It's actually contributed a lot the past couple of weeks to how I've been feeling. I have been so stressed out because this whole duckling situation was completely unexpected for us, and the moms outside are not really being very good moms, hence why I keep having to bring ducklings inside. It's kind of all this extra stuff that's been added to my plate that has absolutely added to my stress levels, and it's a good test of how well I'm coping with things because life happens, right? And I can't fall back on those old habits that I had to deal with stress, and I have certainly felt a lot of stress. There's a lot of different things going on in my life right now, and I still get that urge to solve that problem with food. 6 months into this process, still have that problem, still have that urge. The difference is how I recognize it and move forward from this point on. So yesterday, for example, it was Friday. It was the end to a just horrid week, just a horrid. I looked at my boyfriend and I said, I'm about to go emotionally eat. I recognize this. I'm gonna go get a cookie before dinner. I do not need this cookie. I just want this cookie because I feel bad, but I am acknowledging that, and that makes it okay, right? And you know, it's one of those things, like, I can recognize it now so much easier than I did before. Before, I would just emotionally eat and start binging, and I knew there was a connection, but I never really would have that light bulb that goes off in my brain, right? That's like, you're doing this thing, and it's not the appropriate way to be handling the situation. I did. I went and I ate that cookie, but I balanced it out. I didn't eat dessert after dinner because I had it before dinner, and I just kind of dealt with it. I didn't eat more than that. I can't eat more than that. I mean, I can't binge anymore, which is just, that's a whole other video that I'm gonna film, but it is a lifesaver for me that I cannot rely on that feeling anymore. I cannot physically fit that much food anymore, even though I still struggle with those feelings and that inappropriate way to cope with problems and stress. It's not the thing that I can just mindlessly do anymore. I have to work through it, and that is really important, and I'm really glad that I'm kind of forced to head on work with it and acknowledge it and deal with it. So let's get into the stats for this last month, and then I kind of want to do a 6-month overview because this is kind of a milestone. It's that middle point within that first year after surgery. And that first year after surgery is really important. That first year after surgery is probably the toughest and most physically and mentally difficult to get through, but it's also the place where you see the most weight loss and the most progress. So it's really an important milestone, I think, this 6-month mark. So at the beginning of the month, I weighed 272.2 pounds. And at the end of the month, I weighed in at 261.4 pounds. So that's a 10.8 pound loss for the month. I did a little quick math and kind of looking at the last couple of months, and that is actually going down. Last month I had 11.8 pounds lost, and then the month before that I had just over 12 pounds lost. So I am starting to see this gradual decrease. I am not going to worry about it. There's a few different reasons for that I think I'll get into later. The big one being that I'm still losing about 11 pounds a month, and that is extremely, extremely reasonable. And it's great. I mean, it's great weight loss. And even if I was only losing 5 pounds a month, it is consistent losses that will get me to my end goal. So I want to start de-emphasizing the number that I'm seeing. That being said, I do want to get the most out of the first year after surgery. I read so many things before surgery that said you really don't want to take that first year for granted, because after the first year, it just notoriously gets more difficult to lose the weight. So you really, really want to get the most out of that first year. So I would like to make a couple changes just personally based on the experiences and the observations that I've made over the last 6 months, to try to see if the next 6 months I can get the most out of my weight loss without also driving myself nuts, because that is a huge thing. I don't want to drive myself nuts. I don't want to get myself into this super restrictive, super obsessive position of trying to lose the most weight possible and freaking out about it. So I have to find that balance, but I would like to see if I can make some of those changes that I think would benefit me overall now that I kind of know more of what I'm doing. And looking at that bigger picture, looking at that full 6 months, I'm really proud of the progress that I've made. And if I get so wound up within these individual weeks or these individual months, it's really going to help me lose focus on what that big picture is. So if I look at the big picture, I am down 112.6 pounds since I started pre-op. I'll throw those stats up here just so that you have a chance to look at them. I started pre-op in October at 374 pounds. My surgery weight was 344, and since I weigh 261.4 now, although technically I did weigh in at 258 this morning, but these are minute details that really don't matter. That's almost 113 pounds in this process so far. And that's not even including my highest weight, which my highest weight recorded was 383.3 pounds. What's the math on that? Yeah, I know this is really stupid. Anyway, that's like 122 pounds roughly. That's crazy. I mean, since I decided to get control over my life and my weight, I've lost 122 pounds. So that big picture means way more to me than whether or not this last week I lost very much or this last month was lower than the month before. I don't want to start worrying that what I'm seeing is a trend when I don't even know if it's a trend. And in the grand scheme of things, in a relatively short amount of time, less than a year, I've lost over 120 pounds. That is why I try not to have so much emphasis on the scale. And I really encourage people to try to pull back from being obsessed over the numbers. The non-scale victories, or the things that I can accomplish, the things that I can do now, make this process worth it. Like 150 million times over compared to just looking at the numbers. The number on the scale is a data point, and it does help me, get some information, but it's not the only information that matters. The fact that I am more comfortable doing things, that I can run around, that I can get up and down off of the ground without dying. I can walk upstairs and not even think about it. There's so many things that I can do now that make so big of a difference in my life that ultimately, in the grand scheme of things, I don't really care what the number says. I just don't. I have confidence that I will continue moving forward and that number will get down to something that I would like to see, but I don't want to obsess over it. Have I made this clear enough? I keep talking about not obsessing over numbers in all of my videos, but I'm so serious. Stop obsessing over numbers. I know you're obsessing over numbers. Stop it. I'm talking to myself and I'm talking to you. So I talked earlier about wanting to try to make some changes over some things that I have observed. And I have always been about this mentality of healing my relationship with food, right? And how I really want to make sure that I'm not excluding things just because people say that certain foods are bad or good or worse for you or better for you. And I don't want to get into this mentality where I feel like I have a list of foods that I can eat and a list of foods that I can't eat. And if you suffer from binge eating disorder, that's not good. It's just not good. So I don't want to get myself into this unhealthy mentality of food morality, because I think it's a BS concept. Absolutely BS and completely counterproductive when it comes to weight loss. That being said, I've been so focused on that that I really do think that I am eating things that I really don't need to be eating just to prove a point that I can eat it and it's like not off the table. There are a few foods that I keep buying that I have learned over time now that I really don't like all that much. They're not any more convenient than something else, and I keep buying it just because. I think part of it has to do with feeling like, you know, I liked it a lot before, so I just kind of want to hold on to like, well, I like that and I want to eat it. But if I'm real with myself, I don't really enjoy eating it. So an example would be Uncrustable sandwiches. Now, Uncrustable sandwiches were a guilty pleasure of mine and were a binge food of mine. I would go to the store. I'm going to end up talking about binging again, but this is all these details are for another video. There's so much information there. But just the nitty gritty of it is I would go to the store and I would just buy tons of snacks, thousands of calories worth of snacks. And Uncrustables would almost always be in the mix. And I would eat like 2 or 3 of them in a binging session because I just love peanut butter and jelly sandwiches. And there's something about Uncrustables that are really yummy. I don't want to talk about it anymore. The point is I went to Target, and Target's the only place that I found the reduced sugar Uncrustables. And so in my mind, I'm like, here's an Uncrustable that makes more sense for me to eat. So I'm going to get one while I'm at Target because it's the only place I know to pick up the box. And I'll just occasionally eat one for lunch. And that's been great. I still have 2 in my fridge. I'm not going through them quickly or anything. But when I do eat them, I notice that not only do they not taste as good as they did before, so they're not really satisfying anything for me, but there's a lot of bread. And I don't mean that in the sense of carbs are bad, I shouldn't be eating that. I mean that in the sense that it fills me up much quicker than some of the other things that I can eat and isn't really giving me too much nutrition there. And also it never really sits quite as nice as something else could in my stomach. I have noticed personally that things that are very like squishy bready just don't sit very well with me. Some people notice that they can't really eat rice without getting that feeling. Some people it's bread and sandwiches, or sometimes even meat. Sometimes people have issues with meat sitting really heavy and uncomfortably with them. It really does depend on each person. So that's why I really hesitate to say like, oh, you shouldn't eat this because it's gonna not sit well with you. Rice doesn't bother me at all. And there are a bunch of people who say they haven't been able to eat it for years. But if I have noticed that fluffy bread type things do sort of irritate my stomach, I'm not getting the kind of protein and nutrients that I really wish that I was getting, and it just doesn't really make me feel good, then why bother? I've noticed a little bit of this change so far when it comes to my dinners. I am just voluntarily foregoing any side that's starchy or carby or something like that because I'm finding that I feel better if I just stick with a protein and a vegetable. Those are the kind of changes that I would like to start implementing more in my life now. I want to start moving towards just eating, I guess you can call it intuitively. Rather than thinking so hard about what I'm eating, I would like to just get into this groove of eating the things that I know make me feel good. Because if I pay attention to that, then I'm always in a good situation. I'm eating things that make me feel good, that keep me fueled, that keep my protein high, and I'm never going to be the kind of person who avoids carbs entirely. I don't. I love sweet potatoes too much to avoid carbs entirely. But like the refined carbs, the breads, things like that, I can eat in much, much smaller quantities and still be very happy. The other thing I want to start implementing in my life is exercise. I've gotten this far without really exercising at all. In fact, I'm not even going on as many walks as I was before. I was trying to really at least have that be like my thing, and I just kind of fell out of that habit pretty easily. I don't exercise very much. I don't even hit close to 10,000 steps very often. And that's something that I want to change. Partially because I think exercise is important and it does make me feel good. And now that I have more ability, it's less of a chore and a horrible thing. The other thing though is that I am noticing that I am weaker than I was before. I think I've mentioned in a prior video that it's kind of impossible not to lose some muscle mass during this process. When you're losing vast amounts of weight through weight loss surgery very quickly, it's not just fat. We like to think, oh, I'm just burning away all this fat. But that's one reason why we're encouraged to eat a lot of protein, is to try to encourage our muscles to stay around as much as possible. But you will inevitably, unless you are strength training like the whole entire time, you will inevitably start losing some muscle mass. And I've noticed that I'm weaker. And sometimes it's harder for me to lift things that I wouldn't think I would have a problem with. So I really want to start incorporating some type of strength training. It doesn't have to be crazy. I mean, I would love to be like a bodybuilder and start heavy lifting, but I'm nowhere near that. Some resistance training, some work with some dumbbells, some strength training just to start feeling like I am building muscle again. I very much enjoyed that when I used to go to the gym. I think I'm ready to start adding exercise into the mix. I probably should have before the 6-month mark, but there really is something to say about just feeling like crap, feeling too heavy and not having an ability to do things without being overly winded and miserable. You just don't really want to start doing those things. I want to exercise because I want to, not because I feel like I have to. And I'm at that point now. I feel good. I feel like I'm ready to start bringing that back. And I feel like now's the time to do it. The last thing I really wanted to touch on about my 6-month update were a couple of medical updates that I have. I did do my 6-month appointment with my doctor, where she takes like 12 vials of blood from me and runs the whole gambit on my vitamin levels. The update there is that she is pleased with where I'm at. I'm not deficient in any of my vitamins at this point. I am a little bit elevated in a couple of things, but she's not really too worried about them. One of them, oddly enough, is copper. I've been high in my copper for my 3 and 6-month blood work, and it's not really going down at all. We do suspect that it's because the bariatric multivitamin that I take does have 200% of your daily dose. But all of the bariatric vitamins that I find have that. Most of the time, the percentages in those bariatric vitamins are jumped up significantly, because if you have a malabsorptive surgery like me, I'm not getting all 200% of that, which is why it's a higher dose. It's trying to absorb as much as I can. For some reason, my body seems to be absorbing the copper without any problems. So that's been a little elevated. But we were talking about it in detail, and I was asking if she felt that it would be appropriate for me to move away from a bariatric vitamin and maybe take 2 regular vitamins so that I can decrease that amount of copper. And she said that she wasn't really too worried about it. She would rather me be on the bariatric vitamins for the first year after surgery, and then at that year mark, if my copper levels are still elevated, she will recommend maybe we make some changes. Again, she's not worried and she's watching it, so that's all that matters to me. At my 3-month mark, I had really high B12 levels. And I'm trying really hard not to go on my soapbox about B12 because there's so much misinformation out there about B12. But her recommendation was for me to start taking my B12 supplement every other day instead of every day, since I did have elevated levels. And so I switched over to taking it Monday, Wednesday, and Friday, and my levels are smack dab perfect in the middle, and she's very happy with that now. So that's something that I will continue to keep that change. And then the other medical update I had mentioned in my gallbladder video, and I'll link that up there, that I was having some organ pain, some abdominal pain, and that I had been talking to my doctor about it. We were watching it. We thought maybe it was gallstones. I did have an appointment with a gastrointestinal specialist. I had to wait really long for that appointment, so I was very glad that my pain had gone away. But when I was talking with her, she really felt that it was not gallstones, which is something that I was fairly confident about as well. And when I was talking to her about things, we came to this conclusion that we think the issue that I was having and what I was feeling had to do with the omeprazole that I'm taking. So I was prescribed omeprazole after surgery and got some at the pharmacy in Mexico. And it is an automatic thing that Mexico Bariatric Center prescribes for people who go through weight loss surgery, because especially if you get the sleeve, there is an increased risk for acid reflux. And omeprazole is an acid inhibitor that will help that. It is really not likely to see acid reflux in gastric bypass patients. So I figured once I ran out, I probably won't take it anymore because I don't see a reason why. I wasn't having any issues. It's not really common to see issues. So I would just take it as recommended and then kind of be done with it. But right around the time that I was feeling this pain, I had realized that I actually had recently run out of my omeprazole. And I started to be suspicious that the feeling I had was the feeling of excess stomach acid. And instead of it feeling like heartburn and acid reflux where it's going up into the esophagus, I was just feeling it in my stomach where it was sitting and gathering and making me feel really sick and in pain. After talking with the specialist, she thinks that's what was going on. And she said that's entirely possible because we don't see a lot of acid reflux with gastric bypass patients. It is possible that I just was feeling it internally as it was sitting in my stomach, burning away. She didn't feel like I needed to worry about getting my gallbladder out. She didn't feel that I really had a gallbladder issue, even though I did have a stone come up in the ultrasound. Of course I have a stone. I had one years ago and they don't really go away. She wasn't concerned about the placement of the stone. Everything looks fine. So she did say, obviously, if I have pain again or something returns, that I would maybe want to go get something checked out further. But ultimately, she thinks as long as I continue to take omeprazole, which I have been, and I grabbed some at Costco, then there's really probably no problem here, which is a bit of a relief. So that's it. That's my 6-month update. That's everything that's been happening for the last 6 months. That's my progress and where I'm at currently. And I feel personally, reflecting back, that I've been really proud of everything that's happened so far. And I think this is going to be a constant learning process. I'm never going to feel like I'm a failure if I realize months down the line that I need to make a change. I think this is such a personal process that some of it, yes, is sort of universal among surgery patients, but we all need to experience and experiment with different things individually so that we know what things are like and how they affect us, and the best way for us to get through our surgery mentally and physically intact. If you're looking for a duck update, so they grow so much in 1 week. She's not having any of it. She's like, why are you touching me? Look at how huge she got. So big. And I would show you the other two that I brought in recently because they're just itty bitty and they're adorable, but they're actually sleeping. Thank you so much for watching and following along. I hope the updates are informative and helpful for anybody who's thinking about going through this journey or has already started the process. I really just like kind of putting things out there in terms of what my personal experience has been, because I think getting as many perspectives as possible is helpful when you're trying to get through this process and you're trying to figure out, you know, how you're supposed to navigate everything. If you haven't already, please consider subscribing, liking the video, sharing it. It does help the algorithm and get my information out to as many people as possible. That's the only real reason that I do any of these videos, is to just try to make things available for people. So if you can give the algorithm a little bit of a boost if you like the video, that'd be awesome. And I'll be coming at you next week with another video. So I'll see you in the next one. Bye.